Good morning. So we're going to talk this morning about careers in healthcare, and I'm really pleased to be here and to have this conversation with you. Our objectives are basically three this morning. First, I want to give you an understanding of what the healthcare crisis exists as far as the healthcare workers are concerned. We are actually going through a severe catastrophe, not just here in the Valley, but across the nation. If you talk to any hospital system anywhere, I was actually in Atlanta day before yesterday, visiting Emory University and Grady Hospital, and I can tell you that they are actually functioning at about 60% of their capacity because of lack of staff, both of them. Grady Hospital is a county hospital which actually takes care of the underserved and uninsured, and they are unable to actually do that. So we will try to impress upon you what the crisis exists. Number two is that we want to share with you the various career pathways that exist in healthcare, so that when the students and the parents come to you, you can actually talk to them and provide them with the information in the most appropriate fashion. I must tell you that this is not a recruitment activity. We are not here to recruit. We are not here to actually impress upon you that you should tell your students and the parents that they should come to DHR. This is actually a public service that we are doing, working with Region 1 and with our partners. And then we want to provide you with the most updated resources. And when I say use the word updated, I'll tell you in a minute what we have done in terms of providing you with this information, and we will walk through that. But before I go any further, I would like to introduce two individuals. Where is Monica? Monica Betancourt Garcia, who actually introduced me. She's our director for the Center of Excellence for Trauma Research. She is actually a local, born and raised in this particular part of the Valley, went out, did her MD, and came back and is now serving this particular community in many different ways. Not only that she was instrumental in getting us the Trauma Level 1 designation at DHR, which is the only Level 1 trauma center in the entire Valley, but she's, yes, please. But she's also responsible for a number of other things that are happening, one of which is that she's the head of our BioBank, where we are actually taking samples from Hispanics and people of Hispanic origin and working on them to see how we can best understand the disease process in them. So Monica, thank you very much. Monica has also been extremely instrumental in putting our partnership with Region 1 in place, and more importantly, in all of the events that we have had with Region 1 as our partner. Melissa? Melissa is actually a AP teacher, was for a long period of time for biology at McAllen High. McAllen Memorial, sorry.
It's important.
Yes. We actually recruited her to come and be the program manager for a lot of activities that we will do with the Region 1. Given her experience with the students, we felt, and also her peers, IEU, we felt that she would be a great instrument in bringing together this particular audience, but at the same time also serve as a liaison with Region 1. She works very closely with Region 1, particularly with Nicole and with Lee. Thank you very much, Melissa. I would also like to acknowledge the team at DHR Health Institute for Research and Development, and I'll tell you very briefly about what this institute is and what our contribution to the community has been for the last 3 years since I have joined. I'd also like to thank DHR Health. Remember that DHR Health Institute is a separate entity from DHR. We are a non-for-profit, federally recognized, and DHR Health is a hospital partner that we work with. Well, in addition to Nicole and Lee, we actually work very closely with other leadership here and also the team here at Region 1. And I'd like to thank them, particularly those who are actually helping us today. Thank you very much for helping us in arranging this. And then we also have participants today from the university, UTRGV. I'd like to also thank them because they were very generous in their time and effort in putting information for you together and being here today, and you'll talk to them later this afternoon. Now, just want to make sure that I emphasize the difference between what we are doing today and what may have happened previously that you may have experienced. Again, we are bringing to you experts in their field. We are not, this is not a recruitment event. We are not a college which is coming with what is offered by the college. We are actually telling you everything and anything that exists in healthcare. And we are bringing one of the best and the brightest minds in this particular field to you. So this is a big difference between what we are offering today and what you may have experienced in the past in such events. This is your agenda. It's actually in your handout that's in your bag. We will start with myself giving you just an overview, and then we will, one of our vice president for research is going to talk about the career pathways that exist in research. I can tell you that in my own institute, there are about 7 positions that are currently open, and I'm unable to recruit. 7 positions. I have got a little over 35 people currently working, but I have 7 open positions, and I'm daily, literally putting it on LinkedIn, putting it on Indeed, putting on various websites, and we are still not able to recruit. Then Dr. Force is going to come, and he's a chief academic officer at DHR Health, a seasoned investigator, a surgeon by training, and he's going to talk to you about walking you through the process. And you can see that we will have Janetti Shiner will be coming in. She's our chief nursing officer at DHR Health, followed by Frank Embreeze. Frank is actually the chair of the Department of PA program at UTRGV. Dennis Davis is our vice president for laboratory services. He's going to talk about what career pathways exist in laboratory services. Dr. Malcolm is actually our chief medical information officer. There are tons of jobs available in informatics within healthcare, tons of them. So you don't have to advise your students to actually go and learn coding. Advise them to become more engaged and involved in healthcare information technology, because that's a blooming field of IT. Dr. Zuna is actually from the University of Houston. He's also the associate director of our pharmacy at DHR, because we have a residency program here from University of Houston School of Pharmacy, College of Pharmacy, and he's going to talk about that. And then I'll come back along with my CEO, Dr. Manish Singh, who's also a bariatric surgeon, CEO of the DHR Health system, and we will talk to you about what we have learned today, and thank you at the end for the closing remarks. Now, in the front pocket of your bags, there is actually a small USB drive. Please don't throw that away, because that USB drive is extremely important. That USB drive is contained within it a handbook, which is an interactive handbook, which is a career pathways in healthcare. And what it does is that these are the table of contents you will see when you will put this in your computer. I would strongly suggest that when you go back to your offices, download it onto your computer and have it sitting on your desktop. Whenever the student comes, depending on what pathway they are interested in, so if you actually click on any of these professions, it will actually take you to the page that is relevant to that profession. Okay? So for example, if you click on careers in medicine, this will actually take you into careers in medicine page. You will see physician MD. You will get everything that you want to know about a physician MD over there. What is their salary range? What is the job description? What is the information that you need? What would it take to get into a medical school? It actually walks you through that process. It gives you appropriate links so that you can actually go to those links, and the students can go to those links, or parents, and then they can actually get the information they need. Now, this is the admission requirement. Any admission requirement that you have for MD schools, this is a generic requirement applicable to about 99% of the schools. So once the students know exactly what they have to do, some of which actually starts in high school. They don't have to wait for undergraduate. They can actually start a lot of this in high school. What are the career advancement pathways, and what are the specialties that exist that may be of interest to the students or their parents or to anyone who wishes to know. And then we have also given you what is the difference between an MD and a DO, which is a doctor of osteopathic medicine. So all this information is actually contained in that small USB drive that you have, and you can actually go and make sure that you actually keep it. Now, why is this important? A student comes to you and says, I'm interested in respiratory therapy. You can basically take them straight to that particular pages, but more importantly, you can either print them or email them those pages and say, here are the pages that I'm giving you, instead of us giving you a 250 book binder, which is of useless. Essentially, it's going to sit on your desk, and the information is not going to be carried to the students or the parents. You can actually now email it to them, immediately print those 2 or 3 pages and give it to them, and say, here, look at this. This may be a source of continued reinforcement for you as you move forward. So I'm going to very briefly talk about the Research Institute. I'm very proud. I don't know if any one of you have had, and I'm asking this with much trepidation, have any one of you have had COVID? Have any, how many of you were actually have received any sort of a convalescent plasma or monoclonal antibody infusion? So anyone who has received convalescent plasma in the entire valley, actually that convalescent plasma came from us. Because we were the ones who actually, when March 23rd was the first patient in 2020 that we actually treated here in the valley. And when the first patient was identified up in Washington State, very quickly we realized, and we were only 1 year old at that time, very quickly we realized that this tsunami is going to hit the valley and the valley is not prepared. So we took on the responsibility and put together a collaborative so that we could actually have 11 hospitals, 92 physicians, and all the county districts over here to actually put together a collaborative so that we can actually help you. So anyone who has received monoclonal antibody treatment, anyone who has received convalescent plasma in the initial part, most likely, it's highly likely that that came from DHR. So prior to 2019, really there was no formalized clinical research center. We are a population of about 2 million people if you look at all the 8 counties. That's more than the state of South and North Dakota. That's how large we are. Okay, so there is a real need for us to have a strong research presence here so that we can bring most innovative clinical research to you. When the standard of care fails is when the research starts. You don't have to go. Our goal is that prevent you from going to MD Anderson or to Houston or to San Antonio for anything, for any treatment that you need. Because we understand that this is not an easy decision on the part of the families to actually go and get themselves treated in an off-site location such as Houston and San Antonio. We have a large group of individuals who are medically underserved and a low socioeconomic status. You are sitting in Hidalgo County at the present time. 30% of the kids in this particular county went to sleep without a meal last night. 30%. 3 out of 10. Think about it. And how can they actually afford a health insurance? They're just trying to meet their, work towards meeting their ends meet. Very high incidence of chronic diseases. Any disease that you pick up is actually in double digit in the valley. Diabetes, obesity, hypertension. Liver diseases is huge. From non-alcoholic fatty liver diseases to liver cirrhosis to liver cancer. Everything happens to be in double digits in this particular. So there is an enormous need for us to work together to not only bridge the gap that currently exists in healthcare workforce, but also to communicate to our friends and family the need for actually getting more and more healthy and getting aware of public disorders. More than 90% of the individuals here in the valley are of Hispanic Latino origin. Now, why is that important? It's important because less than 1% of Hispanics are actually part of any clinical research that goes on in the country. Even the drug like Tylenol, how many of you consume Tylenol on a weekly, monthly, or daily basis? There you go. You may be surprised that it is quite possible that Tylenol may not even be good for you, because most of the work that has been done to determine the effectiveness of Tylenol, more importantly its side effects, have been in Caucasians. And the genetic profile and the genetic makeup of Caucasians, African Americans, and Hispanics is very different. The way you metabolize drugs is very different from the way Hispanics and Caucasians and Southeast Asian metabolize. So the fact that you guys are not even part of the entire decision making of whether this particular drug should actually be used in Hispanics or not is something that we need to work on. And that has been one of the reasons why I actually moved from Dallas over here to set up this institute. And as I said, people travel 300 to 400 miles to get treatment. I mean, I get calls all the time that, Doc, I cannot come for this treatment. I have to go to MD Anderson for my infusion. And I say, why do you have to go to MD Anderson for your infusion? We can infuse you right here. So I think we have to work together, not only to improve the quality of service that we are offering, which we are doing on a daily basis, but at the same time, also remind people that things are available here in the Valley. Now these, by the way, these are not stock images. This lady that you see in the middle is actually Monica Betancourt, okay? And these are all this is our research center that you're looking at right now. We are now the largest and most comprehensive nonprofit institute here in the Valley. We were established, I came here on the 3rd of January, 2019. And we are responsible for providing oversight of research not only at DHR, but all our 72 clinics that we have from Falfurrias all the way to Laredo, and also to the Starr County Memorial Hospital up in Rio Grande City. We are currently involved in over 160 clinical studies. Okay. When I came here in 2019, we had 11 studies. We now have 160 clinical studies, and we are continuing to grow. We have a team of about 35 professionals. And as I said, I have 7 open positions at the present time to fill in the Research Institute. But the research that we are doing is funded by National Institute of Health, National Institute of Aging, National Institute of Allergy, Immunology, and Immunology, by PCORI, which is also a federal agency, and by all major commercial biopharmaceutical entities. So we are not bringing any research. And let me tell you, we are at a stage that I'm refusing more clinical trials than I'm accepting. And the reason is very simple. We want to bring clinical trials that would be relevant to this community. There's no point in bringing clinical trials just because we want another number of 160 to 161. That is not our goal. Our goal is to bring clinical trials that have innovation, the most advanced molecules or drugs or devices, and that are relevant to this particular community. So we are not going to waste our time in bringing clinical trials for diseases that are not prevalent in this particular community. We also have a biobank, and I talked about that. Monica is responsible for that, along with her team. And this is very important because this particular biobank is responsible for taking samples from patients, sometimes healthy volunteers who are of Hispanic origin, and trying to find the biomarkers for the disease in your community. Not only for biomarkers to early diagnosis, but also biomarkers to see how you are progressing as you are treated, and also for post-treatment as to whether you are remission or relapse. Can there be a biomarker for a particular type of disease and its response to a given drug? We are now in 3 locations. Our biggest center is here in Hidalgo, in Edinburgh. We have just started in Brownsville, and we are building a purpose-built 5,000 square feet brick and mortar facility in Rio Grande City. And the idea here is very simple. Take research to the patients. Okay, instead of having patients come from far off places like Brownsville and Rio Grande City and other places to us, we want to go to them. So we're going to take all the protocols that we have to all of these sites that are away from Edinburgh. Now, we have 11 research centers that we have established. You can see most of those are actually in the areas that are of relevant to the community, but the one that I'm going to talk about today very briefly is the South Texas Academy for Education and Training and Research. Now, here is the healthcare crisis that exists at the present time. If you look at the total healthcare workers, there are about 22 million workers in healthcare industry at the present time. Now, this can change. This is 2019 numbers. Okay. This accounts for about 14% of all US workforce. So this is a sizable workforce. Approximately 9.8 million people, or half of them, are employed as physicians, surgeons, and nurses. And the other half are basically as medical assistants and other allied health sciences. So there is an equal division between those who are the providers versus those who are providing support to the providers. Okay. It is one of the largest and fastest growing sector in the US economy. If you look at the US ecosystem and ask yourself, what is the one area which is going to continue to grow, at least during my lifetime, is going to be healthcare. Why? Because more and more people actually, we are living longer, and because of that, we are actually have to take care of individuals for a longer period of time. More importantly, we are actually becoming a sicker community. I'm sorry to say that, but we are becoming a sicker community. Okay, because of our lifestyle and the way we live, the way we eat, the way we function in life, we are becoming sicker community as moving forward. So this long life and a lifestyle is actually a deterrent for a number of things that are happening. And interestingly, 75% of healthcare workforce is actually females. And this actually goes across the board, from physicians down to the level of individuals who are working in the fields such as respiratory therapists, medical assistant, you name it. I think in my own institute, I probably have 2 or 3 males. That includes myself. And I'm very proud of it because the workforce that I have is one of the best workforce that you can actually find. And you will see and work with them throughout the day. Now, what is the projected labor shortage that's happening? Now, primary care physicians are the first go-to physicians when you have a tummy ache or you have a runny nose. These are go-to physicians, which means that they are the ones who are actually extremely important. Look at what will happen, that by 2026, 32,000 physicians in the United States would be retirement eligible, which means that they have, now what is retirement eligible? Is 70 years, not 65, 70 years. So they have already actually worked 5 years more than what the US retirement eligibility is. So for those who are at 70 years, 32,000 by 2026, that's around the corner, ladies and gentlemen, that's around the corner. Projected growth rate, look at this projected growth rate, that there will be nurse practitioners. Essentially what's going to happen in the next decade is that you will see less and less of physicians and more of nurse practitioners. And most likely, even now, you are seeing this. When you go to your physician's office, it's very rare that you will actually meet with the physician. Either it's going to be the physician assistant or the nurse practitioner that you will interact with. She or he is going to write the prescription and you're out the door. Well, that's going to become a norm if we don't make a change. I have got nothing against nurse practitioners and physician assistant. But as a patient, I would at some point like to see my physician. Do you agree with me? So, and if we do not make this particular change, I can tell you that the way things are happening, that we will have more and more physician assistant taking over or nurse practitioners taking over practices and replacing physicians. Not that the physician is going to be there in case they can come and help and provide further guidance if it's a complicated case, but they will be replacing physicians. So 21% growth rate is expected in the nurse practitioners field, and about 4.14%. This actually does not take into account those who have actually reached the retirement age. Okay, if you account for those, and Dr. Force is going to show you this today, it can actually reach up to 15 to 17%. So other areas of workforce, we have about 800,000 skilled and semi-skilled healthcare workers in the United States. Now, this is important. By 2026, we will need close to 1 million people in healthcare work industry, 1 million people by 2026. So the burden on your shoulders, ladies and gentlemen, is huge. Each one of you have to go back to your schools and have this conversation with your peers and with your students and with the parents of how you can help guide the students into this particular workforce. And during the same period, about 500,000 people, or 400,000 close to, will actually leave the workforce. The burnout rate at the present time is huge. COVID-19 has not helped. The whole concept of traveling nurses and traveling physicians and traveling medical assistants has actually decimated the healthcare system as we see it. A lot of people, and I'll show you some of the data from our own hospital of how what the current status is of healthcare workforce in our hospital. And by 2026, we will have about little over 500,000 vacancies in the United States in healthcare workforce. Now, these are all numbers that have been projected by the US Bureau of Census. But these numbers are conservative numbers. What they do not take into account is what will happen in the next 4 years that's going to alter the course of these numbers. Now, here are the open positions that we have, and this is as of Thursday, February 17th. Okay, we have 598 open positions in clinical areas. I'm not talking about administrative areas, clerical areas. No, I'm talking about clinical areas. Look at the position. 203 open positions for registered nurse at the present time. We have CNAs, which are the nurse practitioners. We have about 45 open positions, and you can read it yourself. So these are, and I can go through this list. This list was actually 2-page long, and I stopped at MRI technologist. And if you go actually to this particular website, you can see for yourself all the open positions that we have. We are continuously recruiting. We are giving you bonuses. If you know of a nurse, we'll give you a bonus if they get hired by us. I mean, this is the state of affairs at the present time. Now let's talk about the South Texas Academy for Education and Training and Research. So when we started putting this academy together, we had a vision, and the vision was to inform, educate, and inspire. These are important 3 words that are critical to the establishment of this academy. And who should we inform, educate, or inspire? The community members, i.e. you. You're a very important part of the community. In many ways, you are actually the halo effect that you bring in what you do on a daily basis, both in schools and also in your private life, is huge. And we are going to take advantage of this shamelessly, because we feel that you can actually bring about a serious difference as we move forward. We want to educate, inform, and inspire community members to become critical thinkers. Critical thinking is not necessarily only in science. Critical thinking is even when you are actually ordering food for yourself for the lunch. Okay, what am I going to eat is critical thinking. Isn't it? So critical thinking, what am I going to wear today? Okay, what kind of perfume am I going to put on my body today? All these are critical thinking events that are happening, and we don't realize those. And to engage, we want to engage you in our quest to find solutions. I can tell you, the people standing here on the podium, those who are in the back helping us, Region 1, we are not the only ones who can actually find these solutions without you. You have to be partners with us in finding solutions, and we have a burgeoning healthcare crisis over here. When we sit among our team, we keep on talking about COVID-19 and how this is a public health crisis. There are other public health crises that are happening and we are just ignoring them. The obesity and diabetes and hypertension and liver diseases, these are all endemic problems that we are facing here in our community, and we are totally oblivious. We take it for granted. And our mission is to develop programs to empower learners, i.e. you, your students, your family, and your friends, with the awareness of the public health crisis, and educate and skills to pursue professional careers in biomedical sciences and STEM pathways. That's our mission. We want you to be the catalyst for change. If there is nothing else that you walk away from this particular conference today, just remember, you can bring about a change. And the speed at which the change is going to happen because of your engagement is far beyond anyone's imagination. So the entire event is basically centered around core understanding that you will be a catalyst for change when you walk out of this particular room. Now, here are some of the things that we have already done, and some of your students may actually be part of this. In July of last year, in June, July, we actually started our first engagement with Region 1. And we had a junior clinical research internship. We had a select group of about 12 to 14 students. And we wanted to see how this is going to happen. This was an immersion exercise for the students to actually come and learn about healthcare. Then in November of last year, we actually had another research conference which was related to clinical research and its impact on public health crisis. And about 380 to 400 students and parents attended this particular conference, and this was actually at the DHR campus. Obviously, we are doing one here today. I was hoping that this particular conference would also have been at DHR Health, but unfortunately, we have a very strong mandate for wearing masks, and we didn't want it to actually create any issues there. Again, in June and August, we are actually putting together another junior clinical research internship, this time with about 200 students who are going to come from various school districts across the entire valley. And then in September, we are going to actually go back and redo the public health crisis, because we were only able to reach 380 students. We understand that there are thousands of other students and teachers and parents that we can reach out to. We also have mental health and other critical challenges that exist in our school systems. And we are putting some such similar conferences, bringing in experts to talk to you about how to intervene. And we will be putting similar programs for disadvantaged students. Because up until now, most of what we have offered is to students, they have not been offered to students who are disadvantaged. And so those who are hearing impaired, those who are unable to actually exercise the same level of activity that the rest of the students do. And so we will be putting together some similar programs for those students also. Well, in the end, I'd like to thank you. Thank you very much for attending and for your presence today. Try to be as interactive as possible throughout the day. This is going to be extremely important, because this is an exercise where we are learning from you and you are learning from us. And this is actually a QR code for my business card. You can actually take it down. You are more than welcome to call me. Literally, patients and their families call me 24/7, and I make myself available for anything that I can help with. Again, I thank you for being here today, and I hope you enjoy the rest of your day. Thank you.